Hello friends, in this video I am going to tell you the method to use Amplantz sheaths to remove a very large bladder stone by using pneumatic lithotripsy in a female. The very large bladder stones are not uncommon in adult females. Patients with neurogenic bladder often develop them. If you use traditional cystolithotomy methods to break a very large and voluminous stone in the bladder, it takes a lot of time and becomes very exhausting for the operating surgeon. In patients of very large bladder stone, you have to first understand the composition and the exact three-dimensional size of the bladder stone, which to my mind is crucial for selecting the technique which I am going to reveal to you. A bladder stone, which is mainly made up of oxalates, is usually very hard, and if you break it, it will fragment into rather large and irregular and speculated pieces. A bladder stone made up of mainly urates is likely to be really very brittle, and when you break it, it will fragment into very small pieces. Now in the first technique which I am going to show you, I am recommending a use of a single transurethral placed Amplantz sheath, and this is to be used for moderately large, predominantly urate type of bladder stones. The patient is under spinal anesthesia. First you lubricate the urethra with 2% xylocaine gel very well. Then dilate the urethra to 32 French with metal dilator. Thereafter, place a 30 French Amplantz sheath through the urethra over the dilator. By gentle rotatory movement, the Amplantz sheath can be easily advanced over the dilator and placed through the urethra. Then pass the rigid nephroscope through the Amplantz sheath and inspect the surface of the stone. When you look at the stone, you can have some impression about its composition and friability. Through the nephroscope, pass the pneumatic probe and start disintegrating the stone under nephroscopic vision. As you disintegrate the stone, the minute stone fragments and the stone dust automatically flows out by the side of the nephroscope through the Amplantz sheath. Here you can see stone being disintegrated, and you will realize that a wider Amplantz sheath allows a rapid continuous outflow of irrigant, and with that flow the fragments tend to flow out by themselves. You can see here even the large fragments flowing out through the Amplantz sheath themselves. While using the transurethral Amplantz sheath and working with the nephroscope, the first maneuver is that when you place nephroscope in the center of the lumen, the smaller stone particles can flow out. But if you keep the nephroscope by the side in the lumen of Amplantz sheath, even the larger stone fragments can flow out by themselves. The second maneuver is that you have to distend the bladder as you break the stone, and when there are many particles accumulated in the bladder, suddenly deflate the bladder. So how to distend the bladder with Amplantz sheath in situ? That is the question. I am recommending the use of a gauge piece wrapped around the nephroscope and tightly jutted against the hole of the Amplantz sheath. By this, you can occlude the outflow and leakage of the irrigant fluid and work on to break the stone and simultaneously distend the bladder to the desired capacity. And as you take out the nephroscope, the fluid will come out and will bring with it lot of stone fragments. The third method to use Amplantz is to create rapid in and out pumping movement of the sheath through the urethra. And you can see here this in the video. As you do this, it will take out many large fragments. The fourth maneuver is simple, which is using a triradial forceps for extracting the large pieces of the stone through the Amplantz sheath. These are the fragments. Some of them dropped out by the side of Amplantz sheath and some of them removed through the lumen of Amplantz sheath. So friends, when you use a single Amplantz technique through the urethra, you can use these 4 maneuvers to accomplish your task very fast. The first maneuver is to keep nephroscope sideways within the lumen of Amplantz sheath to create a wider side channel. Second maneuver is to intermittently distend the bladder and deflate the bladder with occluding with the gauge piece. Third maneuver is rapid in and out pumping movement of the sheath. And fourth maneuver is using a triradiate forceps as and when required. The second technique is using 2 Amplantz sheaths. The 30 French Amplantz sheath through the urethra and 26 Amplantz sheath placed suprapubically. And this method is to be used for really very large stones, and if they are hard and oxalate type, this technique is very handy. Here is an animated video showing you a case of a really large bladder stone and 2 Amplantz sheaths have been placed in the bladder, one through urethra and another through suprapubic root, and nephroscope is placed through the suprapubic root. Then you have to break that stone into pieces, and the fragments will, with the continuous flow, will continue to flow out through the wider 30 French Amplantz sheaths themselves. A rapid flow allows you to have good vision and you can work fast. The first maneuver here should be that do not over insert the Amplantz sheath through the urethra in the bladder lumen. If the lumen is well inside the bladder, the fragments will accumulate by the side of the Amplantz sheath around the bladder neck and will not gain entry into the Amplantz sheath. So the correct technique is to keep the beveled tip of Amplantz sheath just at the level of bladder neck. The second maneuver is to tilt the Amplantz sheath towards the vaginal orifice, and thus it acts like a children's slide, and stones can slide out the way children slide down in parks. The third maneuver is, as you have broken multiple particles, lift the tail end of the Amplantz sheath towards the clitoris to gather stone fragments within the sheath, and dropping down towards 6 o'clock, this maneuver up and down movement allows stones to come out really very fast. The fourth maneuver is again rapid in and out movement of the Amplantz sheath, which we showed you a little while ago. Same thing can be done here as well. Fifth maneuver could be that as you are breaking the stone from suprapubic root, ask the assistant to put thumb to occlude the Amplantz sheath's outflow. And as you distend the bladder with many fragments and liquid, lift the Amplantz sheath towards the clitoris and remove the thumb. And quickly the stone fragments will flow out from the Amplantz sheath. Now here is a case where you have 2 Amplantz sheath placed in the lady, and you can see many fragments that have come out through the Amplantz sheath. So friends, when you are using twin Amplantz sheath technique, these 5 maneuvers will enable you to fast finish your task. whatever may be the size of the stone, you can finish it fast. The first maneuver is keep the beveled tip of sheath at the bladder neck. Second is tilt the sheath towards the vaginal orifice to create it as a slide. The third maneuver is to lift the tail of the sheath up and down, right? When you lift it up towards clitoris, pick the stones. When you drop it down towards vagina, stones slide out. The fourth maneuver is rapid in and out movement of the sheath so that it acts like a suction pump. And fifth is occlude the sheath to distend the bladder, and then when you suddenly deflate the bladder, lots of stone rubble will come out along with it. So I hope you will find these tricks of the trade useful, and I thank you for watching this video. In case you have any comment or query or comment, please write on my email.